Now coming to the, I love this point like anything. The pericardium 3 is the chusa. Now give the attention to be given 101%. The mind also present and body also present. Body to hatach. Mind also should be present all the time. So therefore we understand this is the one point which gives me, I love maximum time where day-to-day clinical practice I used to apply for the several patients the pericardium 3. Now where this point is located, I think somebody, I don't tell you who wanted to come, please welcome on. Matte helbardu nanike yak nan karkondru anbuttu, please banni. So pericardium 3, let me see, vertical we will start along with the theoretical aspect. I think Mary? Huh? Lena Mary is in next to me. Let me see. She's the Mary here. The name itself is the Mary, right? So should be great name. Definitely the great points to be activated. The cost of the free for you in order to regulate your brain system, and ultimately you give me some compliments to me since now. So it will cost around minimum $100, but at least you can pay me $50 to me and exchange the money and then give it to me. I think I'll apply all the points for you, but maybe one needle it may cost you, but all the points I'll just insert for you in order to regulate your cardio software and then hardware together to activate in your body system. But normally you are really fortunate, right? So let me start where the pericardium 3 point is located on the cubital crease. Which crease this is? On the cubital crease or the bicep crease or the tendon crease. So this tendon, you semiflex, you do like this may not be possible. You semiflex. Once you do the semiflex in that 45 degree, you just bend your hand, then you can find the tendon that everybody in the Zoom, so all of you in the physical class, try to find out the proper location. Now the time is there. You can collect the information from me. If you have any doubts, then try to find out is the appropriate location. Now let me see. Please come little forward. Then you can see here semiflex. Once you semiflex, then you touch and then feel this tendon. So tendon, which tendon this is? Biceps tendon. Bicep tendon. So these muscles, which muscles is it? Biceps muscles. Bi means is the two. The two muscles are coming downwards direction, then joining and coming to become the one tendon, that tendon to be known as a bicep tendon. Now this bicep tendon, we do have the number of the points on the elbow region, but where exactly this pericardium 3, the super powerful point to treat for all the brain related disorders, we can use the point that is pericardium 3. We try to find out that this is the tendon, in the depression of the bicep tendon on the medial side of the elbow, beside of the artery. So there is a arteries existing on that region. That artery to be known as a brachialis artery is existing. So you just escape that artery and then insert the needle is good. Whether you wanted to use, for example, once you do the needle, you can do it the needling. Otherwise, try to find out any engorged veins are there on that region. Anything the veins are predominantly is visible, that is the blue color veins are there. So that vein you just puncture on that region. That also great improvement for the hemiplegia or some kind of the hemiparesis or the paralysis of the hand, where the flexion and extension is not properly taken place on that particular time. You can use the puncturing of this particular region. However, I cannot see the engorged veins.
Which is not visible, sir?
Now I just try to find out, palpate the artery and palpate the nerve. If there is, you cannot feel it, slightly press that region then you can feel somewhere there is a impulse. Beside of the impulse, you can insert the needle. You just take deep breath. Yes, yeah. So this I used nearly, that is the 2 needle, but we don't want to apply the deeper level. I just inserted the needle maximum level. So this to be known as a cheese. This is the grandmother point or the ha-si point. So immediately when some people have the confusion whether I applied on the artery or the nerve, but you need not to worry. If you feel it, then you just apply side of that. You are not feeling that impulse, then you just try to find out the tendon. Then the medial side is indicating is the pinky side. Medial side means pinky side. You just tendon you can find, you just apply the needle, then the patient feels some kind of the impulse is reaching to the destination of the middle finger. The patient feels some kind of the sensation. So that sensation required, that's called as some kind of the Dechi sensation. If the patient feels some kind of the sensation, so that time that gets a radiation of the vibration to be taken place most of the patients. So in that way that sensation is always is good, where that nerve to be known as a musculocutaneous nerve. From here, from the cervical region, it descends to the downwards direction, reaching to the elbow, reach till that elbow, the nerve to be known as a musculocutaneous nerve, to also to be activated by using this particular point. Further, it comes to the physiological aspect of the pericardium 3. As I told you, is the strengthening to the pericardium. At the same time, it is the earth point of the wood, fire, earth, air, water and water point. The pericardium 3 to be known as a water point. So therefore you remember the water means is the connecting to the kidneys, right? This point is connecting to the kidneys. That means the pericardium 3 point is great point to treat for the numerous diseases normally. But however, this is all the 5 points are treatable for the endocrine system. So this pericardium 3 points are treatable for the gonads. That means is the female and then male. That means for the ovaries for the female, testis for the males. So therefore this pericardium 3 points are good point to treat for all the endocrinology related disorders, especially for the gonads. So therefore SI1, that means is the Sanjo 1, especially the Quan Chung, that is the Sanjo 1 point and also pericardium 3 point. The people are coming from the varicose veins or the hydrocele or the swelling of the scrotum or the epididymic cyst is there, even anything related to the scrotum and also testicles related problem, sperms related problem, ovaries related disorders can be treatable by activating to the pericardium 3 point. At the same time, when the geriatric patients, especially old age patients at the age of 70, 80, 90, 100 years, that time what is required for them is the yang excessive is required, yin is excess for them, yang is deficiency to them. To elevate the yang, what is required? The fire is required. The fire activation to be taken place by activating the pericardium 3 point. So therefore P3 point is the great point to strengthen to the fire element in our body. When required the fire element? At the age of greater than 60, person is very lassitude, haziness or some kind of the fatigueness or lethargy, restlessness and giddiness, and the person doesn't have any activeness. So that particular time, to become the activeness, we can use this point. Once we activate this point, person feel the more energetic. So therefore, at the age of 60, 70 years, the person is feel that even lot of history. In my clinical case study, I wanted to add up here, but some doctor told that you will going to die very short period. That means you just take this woman to the home. So that particular time, many years ago, who came to our center, we activated only one point. She got the survived for 3 years. So therefore, such a powerful point to activating to the central nervous system, that's called as a brain. So however, this is the supreme point to treat for the brain related disorders. Do you know that the brain is governed by the many organs, but the kidney is called as a sea of the marrow. Sea of the marrow is governed by the which organs? The water element organ to be known as the kidneys. Kidneys are good, then the brain also good. So the kidneys are deficiency, the brain also get deficiency. In that way, the pericardium 3 is the equivalent to the Rangu. Rangu is the K2 point, P3 is the Chuza. Chuza, Q-U-Z-E, the Q's, but the pronunciation, right pronunciation to be known as a Chuza. So therefore, you just use the either K2 point or the pericardium 3 point, but the pericardium 3 is the most powerful point to treat for the cardiac system and also for the brain system. Therefore, my clinical experience, certainly we add up this one specific point to treat for the all the sodium ions and then potassium ions which is circulating in the brain system. So that time that get a stagnation in somewhere, that's called as a temporal headache, that's called as a parietal headache, that's called as a frontal headache. Somewhere that get the trigger of that particular region, that to be known as a alpha waves, delta waves, theta waves, gamma waves. Somewhere having the problem, so to regulate for the overall waves in the brain, so that time you can use the pericardium 3 for the numerous diseases. Certainly we can add up. So therefore the brain related, kidney related, heart related problem, collectively we can use it this point. But all the psychological related disorders or the sexual related disorders, mood related disorders, further it is related to the anxiety, depression, mania, schizophrenia, delirium conditions, we can use this specific point, because this point to be known as a among the 9 points, but one point to be known as a supreme point. So P3 point. So therefore you can do the sedation by using this point, or you wanted to do perpendicular needle, or you wanted to do as a tonification method. However you wanted to use it, you can use the pericardium 3, that is the Ha-C point, indicating is the uniting puteal, effusaries, inductories, and then transitories, and then conjunctories. There are the 5 points, which is majorly well, spring, and stream, river, sea. So these are the, which is the sea. Sea is the biggest place where all the well water, then spring water, stream water, river water joining together at which place? C. So therefore the C points are great point. C point also to be known as a conjunctory points. So therefore the conjunctory points, this is the pericardium 3 is the most imperative point to treat for the cluster headache, migraine headache, temporal headache, occipital headache, or the known and unknown cases of the headache. We can use it also to be treatable for the vertigo as well. By the way, this point is the kidney is connecting point. The people who are suffering for the polyuria, the people who are suffering for the nocturnal emission or the nighttime urination passes oftenly, that time you wanted to use the pericardium 3 is the good point to treat for the urine incontinence as well. The chinkness, sneezing or the coughing, it gets the urination. So that specific time you can use the pericardium 3. Either you can use as a needle or you can use at a moxibustion moxibustion. Both are really good to treat for the conditions. By the way, this point is located on the elbow. All the elbow related disorders can be treatable where the extension and flexion is not taken place. That time certainly you can use it. But along with this point, I recommend you, when the elbow problem is there, you are using as a local point. Along with that, you just add up the another point to be known as a C5 and then C6 vertebra, where on the cervical region you just add up together. The instantly patient feel lot of changes, anything related to the elbow pain. Further, this point is related to the pericardium. Then the people having the palpitation or some kind of the tachycardia or the bradycardia, that condition also you can use it. But however, the people who are suffering for the excessive bleeding is happen, that's called as a menorrhagia. Menorrhagia means is the excessive bleeding, menorrhea, right? That time, you know the physiological concept to be known as a pericardium meridian or the pericardium. The one of the major function to be known as a controls the blood as well. Spleen also controls the blood. At the same time, the pericardium also controls the blood. That particular time, excessive menstruation is there, greater than 5 days or the 7 days or the 10 days, woman is suffering. That time you wanted to use the control of the bleeding to be taken place. That time you can use the 3 points to control the bleeding. 1 point to be known as a Chusa P3. Second point to be known as a Tiji, that is the spleen 8. The third point to be known as a Siasi, that is the gallbladder 43. These are the 3 points, are really good point. By the way, according to the Giovanni Massacio, and he told the spleen 1 also good point to control the bleeding once we do the moxibustion to that region. Yes, you can use the spleen 3 or the spleen 1, any spleen point. Spleen or capacity to control the blood, because when it gets the excessive bleeding, that indicating it escape the blood from the capillaries, it escape the blood from the blood vessels, then it causes the bleeding more. So that time it controls the blood inside the blood vessels, should pass the blood precisely to control that capacity. Spleen and then pericardium, both the conditions we can use it. However, this is the amazing point. Any time when the fire is deficient, remember, whenever you feel that pericardium pulse is deficiency, that particular time majorly, first primarily you just ask, since how long do you have the headache? So headache is the main reason where the pericardium having the problem.